So today, let's go over some exercises to help with knee pain. Now, there are different types of pain and different reasons for knee pain. So today we're gonna go over just some general exercises that should cover all the bases or most of the bases. A few weeks ago, I actually had some knee pain. This is the second time this has happened where it was painful in the back of my knee. And if I bent my knee, it was excruciatingly painful. And so as soon as it happened, because this has happened prior, maybe a couple years ago, I immediately started doing some of these exercises. And once I incorporated these exercises, the knee pain within about a week was completely gone. And so I'm gonna go walk you through some of those exercises. Most of them you should just be able to do at home. If you have any short looped bands, you can add those in. But for the most part, we're gonna try to keep it simple. You can do this at home because with what I found with knee pain and joint pain, we're trying to make it really consistent every day. We don't necessarily wanna come in, have to go into the gym and work out really hard for an hour to try to reduce the knee pain. It doesn't really work that way generally. It's more like each day we're trying to do some of these exercises to help reestablish balance. Now, my perspective on knee pain is we're just trying to rebalance, restabilize, re-strengthen the joints and the muscles to kind of hold everything in alignment. If we think that, if the knee joint is sitting perfectly, everything runs smoothly, it bends okay, but if those muscles, kind of get out of alignment, or you have some overactive muscles, we can maybe start kind of grinding a little bit, or just makes that knee function a little bit inappropriately or not the way it should, and so that can cause that pain. So we're trying to reestablish balance, and so we're just going through the joints surrounding the knee to optimize them so that we can reduce that pain. So the first thing I recommend is opening up your hips and make sure that your hips are doing what they should. So for this, I recommend the Active 90-90. I have some videos on this, but just as a refresher, you're gonna sit in this 90-90 position, right? So you center of your chest in line with that knee, 90 degrees here, 90 degrees here. If I put my arm out, I'm lined up with my knee and my shoulder. And so we're gonna keep a tall spine. We're gonna lean forward and we're gonna drive that front knee and ankle into the floor as hard as we can. So we're creating isometric tension into the floor and holding 1, 2, 3, 4, 5, and then back up, right? Take a second and then do it again. Forward, drive down, 1, 2, 3, 4, 5. I would repeat that 5 times on this side and then switch and then do 5 times on this side. Same thing. And so the intent is that you're pushing into the floor, you're activating those muscles to help balance, restabilize the hips and get those muscles doing their job. Next, what I would go to is a ankle stretch. So again, we're trying to discern where that knee pain is coming from. So without assessing you, without looking at you move, we're just gonna kind of cover our bases, right? So we open up the hips and then we open up the ankles. So the great movement for this is the combat stretch. So getting in this position here, you're gonna let your knee come forward as far past your toes as you can while the heel stays on the ground. Once you reach that end range of motion, you're gonna just think about pulling your toes up. You're gonna hold 5 seconds. 1, 2, 3, 4, 5. You're gonna come back and you're gonna repeat, right? Forward, heel stays down, pulling those toes up. 1, 2, 3, 4, 5, and back up. 5 times on this side, then switch and do 5 times on this side. So those are our priming movements for the joints themselves to help make sure that they're at least moving the way they should. Next, I would get into some of the exercises. So the muscles I tend to focus on that help give the most bang for your buck when it comes to knee pain or helping reduce knee pain are strengthening the glutes and especially the glute med, right? The side of your butt there. So one of the movements that I really like for this and that helped me a lot is the side plank clamshell. So what you're gonna do is you're gonna lay down like this. Your shoulder is right above your elbow. Okay, your knees are slightly bent. You're gonna come up into this side plank position. You're gonna open up your knee, this top knee, and then you're gonna take that bottom knee and you're gonna drive it into the floor as hard as you can. 1, 2, 3, 4, 5, down. Okay, take a second, breathe, then come back up. Open up, drive that bottom knee into the floor as hard as you can. 1, 2, 3, 4, 5, and down. Repeat 5 times, switch and do the other side. So the bottom glute is what's working because you're pushing against the floor, and that can really help activate those muscles and help restabilize the relationship between the hip and the knee. Next is an exercise called the hip airplane. So again, we're trying to get the glutes to fire, to activate, to turn back on, restabilize the hip and the knee. So you can use a counter, you can use a chair, anything that's generally about hip width or hip height, and then up maybe a little bit. You don't want it too high, you don't want it too low, but you just want to be able to grab onto it, and you're going to extend one leg behind you, okay, like this. You're going to drop your hips down, and then you're going to try to open up, right? And when you're opening up, you should feel your glute fire really hard. You're going to hold 5 seconds. 1, 2, 3, 4, 5, down, and then again, up, squeeze, hold, 1, 2, 3, 4, 5, down, and repeat. For now, you can just do the side that hurts. If both knees hurt, obviously do both sides, but if just one side hurts, just repeat that for 5 repetitions on the side that is the most painful. Another exercise that really helped when I was having knee pain is to actually just work the quad out and go through that full range of motion as much as I could. Now, at the time, I couldn't get full range of motion. So it might be the same for you. You might not be able to get full range of motion here. That's okay. But you're trying to work those muscles out as much as possible. If we stop moving that joint, then we're likely to probably aggravate the issue. So what you're going to do, you're going to sit down in a chair, on your couch, in your car. Generally, you want to be a little bit higher versus a little bit lower. And from this position, all you're going to do is extend your leg out, flex that quad as hard as you can, and then back down. And then again, up, flex. I'm trying to hold 1, 2, 3, and down. And what we're trying to do is work this muscle here, right? We're just trying to work that out. 1, 2, 3, and back down. I'll change the angle here so you can see, right? So we're right here, extending out, flex that quad, 1, 2, 3, and then back down. Sometimes it's helpful to push on it if you have trouble feeling that muscle. So you can take your fingers, push them in, right? Flex, 1, 2, 3, and down. And like I said, if you can't get that full range of motion, that's okay. You want to work with whatever you can get, right? So if that's here, just do that, hold, and then back down, right? And what you're going to try to do, this is one that I would practice multiple times a day. So probably 3 times a day, because I was trying to get more and more range of motion, right, over time. And so this one helped a lot when I was having that knee pain. So next, the last exercise that I would tell you to do, this one can be a little bit harder if you're having knee pain, but if you can do it, it was also really effective for me. So what you're gonna do is you're gonna make sure you have plenty of space behind you. You're gonna step back, and when you come down, you're actually gonna rotate over the knee that's in front, like this, and then come back and step back up. And then back, down, rotate, hold there for a second, and back up, okay? And then you repeat. So generally I do 3 to 10 repetitions. Hold, back up, back down, hold, back up. So that really helps actually engage your core, which helps stabilizes your hips. When your hips are more stable, your knee is more stable. It also helps engage the glutes to do their job. So a lot of times when we're having knee pain or really any joint pain, it's a lot of times coming from a muscle or multiple muscles not doing what they should. And so if we can get those muscles to turn back on, generally we can see some pain relief, right? And in some cases with clients, their pain completely goes away. But at the very least, we want to see it reduced. So these are some exercises you can try at home to help with knee pain. If you have any questions, comments, concerns, or jokes, feel free to reach out and let me know.